I'll give you some ranges of things out there in terms of unnecessary care. As many as 20% of transplants are unnecessary. As many as 20 to 30% of cabbages are unnecessary. As many as 30% of other heart procedures are unnecessary. As many as 100% or 100% of arthroscopic knee surgery for arthritis is unnecessary. As much as 80% of hysterectomies, when the primary diagnosis for a woman during menopause is general symptoms, is unnecessary. Think about how many dollars we could take out of the system if we eliminated the unnecessary treatment. One of the things that we were really focused on in terms of trying to create medical literacy is what are some tools that we can provide that really help members learn about their condition. And we partner with WiserTogether, and they have a model in terms that's really driven off of behavioral health or behavior concepts around the fact that you want someone to learn, compare, connect, and then decide. And what we really like about the program with WiserTogether is that it gives people this very interesting dynamic of comparing. So when an individual goes into the site, and let's take the Wiser pregnancy version, so they have multiple versions, Wiser pregnancy, Wiser motion for musculoskeletal, mental health section, and a couple others that they're working on. You go in and you get the opportunity to spend some time learning latest evidence-based medicine guidelines for your specific condition, treatment options, all of those types of things, including things that are alternative medicine. So ensuring that people see the full spectrum of what is available to them. Then the opportunity to connect is critical. And so in the tool, you're actually able to connect with peers and see how many of your peers who have the same condition used what treatments, how successful was it, what were their outcomes, those types of things. But then what's really unique about this is that you get to look at physicians who had the same condition and what were their, what treatments did they select and what were their outcomes. What's fascinating when you go through this is how different physicians are treated, or the treatments they receive, than the general population. It's really eye-opening. And so it's a really powerful way for people to start thinking about becoming medically literate and becoming more engaged. And then they get to have a conversation with their physician that says, hey, I've got this information about how your peers, Dr. Smith, treated this condition and what their outcomes were. And I'd like to have a conversation about these evidence-based medicine guidelines because you have suggested a treatment path that doesn't necessarily follow an evidence-based medicine guideline. So I'd like to have that conversation. So this is a way for us to kickstart this process of where we want people to be. It's a real savings from a cost perspective to the system, fewer office visits. It's a real savings from tests, and it's a real savings from a productivity perspective. So getting questions answered, having a source to go to, a trusted source to get information, so we don't have to go to the physician's office to get those questions asked. So it's one of the big sells for us.